we are already in the process of drafting the quality of care bill. We've already done the assessment of levels of all the hospitals in the country, more than 14,000 health facilities in the country. So what is remaining is knowing what will these health facilities bring on the table. Will the human resources for health in these health facilities perform properly their mandate? Do we have the right equipment and modern ones to give the quality that we deserve? Is the infrastructure in these health facilities enough to sustain a specific primary care network? So the quality of care is very important. And if we have a guideline, an act guiding onto how these hospitals can be inspected, and when they are inspected, they will be approved, and those are the health facilities that will be used at the Social Health Insurance Authority. They'll be recommended to be serving the people using the social health. By 1st of March, we are sure that, God willing, we will be able to start the registration process of the social health insurance. It is good for Kenyans, it is good for all of us, so that we also do not keep subjecting only the people with a pay slip to pay for insurance. The health facilities at the bottom of the pyramid, the level 2, when you go to hospital, you will not be charged. And as you progress to other levels, then you will be subjected to produce your social health insurance card. And finally, somebody may ask, what about those who cannot afford? The government has a way of getting to know the economic status of each and every individual in the country. And scientifically, we will be able to tell that you can afford 300 shillings or you may not afford. If you cannot afford, then the government will cater for you this money for insurance for the indigents, people who are not able to afford even 100 shillings, and we will know who these people are. So not everybody will feel I cannot afford, and we agree. There are those who may afford, there are those who may not afford, and they will be catered for. Everybody must be treated and treated properly, given quality health care. I know yesterday when we were talking, when we were at the burial of the 17 individuals who died in Kangai village, I know this is really disturbing to everybody, and as a department we will be able to go back and look into our psychologists and counselors council and see if we can bring psychologists to the counties and also deal with the ones who are already existing there, and start on a program that will be able to see these people rehabilitated and equally given direction. Because sometimes when you're an addict, it gets time to actually get it out of your system. Therefore, we will commit to have something for the people so that we are able to put them together and they are able to continue with their lives normally. Therefore, I'm happy for this morning, and we shall continue looking into the issues that Kenyans are waiting for, especially in Kirinyaga, where we buried 17 individuals yesterday. A mass that was attended by His Excellency, the Deputy President of the Republic of Kenya, the Governor of Kirinyaga County. And I wish to reiterate that it's never so serious that you must misuse alcohol or drugs and substance. It is important for the youths and the young and the old in this county to know that alcohol is something that can damage you health-wise. First, health-wise. It can cause heart attacks, it can cause cancer, it can cause diseases that you never expected. Therefore, it is important for people to take caution and be able to really move forward without necessarily causing a lot of havoc. Again, alcohol causes a lot of disability in our families. We don't have sustainability because kama kichwa yako imechokorwa, then you are likely to go and cause havoc in your own family. Therefore, there's no love, there's no unity, and there's a lot of problems in our society. So pombe ni kitu inatuharibia mpaka maboma zetu, and we are not able to sustain the even little harmony that we have in our homes. But I also want to call upon the County Assembly of Kirinyaga, na niko nao hapa. I want to beseech them that they pass the alcohol bill that is in the House. It will be important to give direction and to give a structure on the way forward in terms of usage, in terms of sale. It gives relief to the merchants equally, and giving regulations on how to run businesses. Then we will not have infiltration of illicit brew in our county or in the county of Kirinyaga. And this passes across even Mount Kenya region or even across the country. It is good to have an alcohol bill that will be passed and signed into act to ensure that we are able to streamline and have regulations laid down properly for merchants and for anybody who is in the business of selling alcohol.
Naweza confirm a correct bill in Kirinyaga County Assembly. Tumefanya first reading, tukafanya public participation, na hiyo bill ni common in 10 counties. First county to pass the bill ni Nyandarua, and I'm hoping and I'm focused as a majority leader in Kirinyaga County to ensure that the Kirinyaga becomes the second county to pass the bill and to approve. Once the 10 counties approve the bill, I can assure and guarantee the residents and actually Mount Kenya region there will be a common bill in alcoholic consumption and usage and bus approval. Kwa hivyo tutakuwa common across the board. Hakuna mwenye atakuwa na advantage na disadvantage kwa wale mwingine. Kenya naweza urge our business community kupitia directive jana ya governor, club zote sifungwe, bar zote sifungwe na apply a fresh inspections. Kenya naweza wauliza apply kutoka kesho tufanye inspections, waanzie biashara zao instead ya kwenda kotini kusumbua kuanza mvutano katikati ya government na business people at the expense of our people. Tukifanya hivyo kazi itakuwa mzuri, na ili kwa hizo club watu inspection wakuja waangalie ni pombe gani iko, unauza pombe ya aina gani, ni gani iko approved, ni gani si approved, then unapewa go ahead ya kuuza pombe. Lakini ndio nauliza na naweza shukuru enforcement team kwa ile kazi mzuri wamefanya kutoka jana. Wameensure the directive ya president, deputy president and governor implemented, na jana kazi haikuwa mingi, na ndio nashukuru kwa kazi mzuri wamefanya. Asante.